Namaste dosto, welcome back to my channel. Do you know that how many hours you spend entering the patient records by typing into the HIMS? Is it 1 hour, 2 hour or more than that? So with help of HIMS, that is NICE HMS, with the newer technologies which is artificial intelligence based, that is NICE HMS, we are able to cut down your work from hours to minutes. Whether you are a doctor or a resident or a postgraduate student or administrator, NICE HMS is there to help you to reduce this work. This Scribe of NICE HMS is pretty advanced. The way you speak in real time, it converts it to the text and the output is given, and that output can be further edited and saved. I'll go to the demo in this video tutorial. Imagine those old days when sister used to come to your clinic inside with the bulk of records and used to dig into the files, struggling to find out what are there, then used to find some notes, then used to try to make some conclusion, then used to write a prescription. This was a very hefty task. On other side, you also used to type and give, but then you used to dictate. Your typist used to sit and type, and that medical transcriptionist, after typing, they'll show it to you whether it is right or wrong. Then the prescription was given. This was a round trip and a very lengthy process. With help of this speech to text technology, well integrated in NICE HMS, this back and forth work is grossly reduced and the records generated are much accurate. And in this video, I will show you how exactly it is done, especially the diagnostic reports and the discharge summaries. You all know that the diagnostic reports, that basically what I am speaking is ultrasound reports, CT scan reports, or even X-ray reports, mammography reports, such which are text based. Usually the radiologist dictates the reports and the typist sitting by the side will type it. This is a very lengthy process and it is prone for errors. Similarly, the discharge summary is actually created from the looking back and forth the diagnosis report what are come, and ultimately the diagnosis report is created. This is also error prone, and the consultant will have to struggle a lot final declaring that the diagnostic report or discharge summary created is accurate or not. With help of the NICE HMS, with help of the AI, this job has been reduced to 90%. In this demo, I will show you how exactly that is done. In this, I will show the diagnostic report is generated with the help of the template and text to speech. First, I will load the coronary angiography report and tell you how it is done. So I'll take a coronary angiography here, I'll load it. So I have loaded coronary angiography report here. First I'll reset everything's here. There is a plain coronary angiography report which is normal here. So what I'll do is I'll start dictating the words once. See, left anterior descending artery bifurcates into left anterior descending artery and left circumflex artery. Left circumflex artery is a dominant vessel with big OM1, and OM1 proximally has got 80% lesion, and even the left anterior descending artery mid has got 99% lesion. At the RCA distally there is a mild plaque. So patient has been advised to undergo PTCA with stenting to OM1 and left anterior descending artery. It is a double vessel disease. Now I have dictated here, you can able to see the dictation. Now you are able to see the original text. What I'll do is I'll just generate the report with this. This is not limited to the coronary angiography. You can even do it with anything, ultrasound, CT scan, anything you can do it. That can be done. So this is the future. See, just see now what happened. See, IHD, acute coronary syndrome. See, it is a left-handed mid LAD, has got 80% stenosis. D1 is not mentioned. Not mentioned. It is not. OM, it is C. Proximal, it has taken this. RCA, not mentioned. PDA, not mentioned, and double vessel disease. PTCA with sending to LAD and LCX. In case if it is not mentioned, you want to do edit, you can edit also. You can say here normal, normal, you can say like that. You can modify and take a print. That also can be done. That also can be done. So this will accelerate your reporting. It's not just limited to the coronary angiography report. Even you can do it with your ultrasound, CT scan, anything. This can be done. Similarly, I have shown in other reports like discharge summary. I'll show one discharge summary for that matter. Discharge summary here. I'll try to generate one discharge summary. I'll show here. Discharge summary. Hold on. I went for diet. Sorry. Even diet is also there. And discharge summary also can be created. This is for diet creation. I given one more video for generating diet, how it is done. You can go through that. I'll put the link in the description. You can go through that. Here. See here. Now what I'll do is I will just try to generate a diet discharge summary. See here, these are the already discharge summary has been created with the help of the AI. In fact, you can see the diagnosis is not properly written. I can make ICD-11 diagnosis here. ICD-11 diagnosis here. See, it takes ICD-11 diagnosis. Then type 2 DM. I can go type 2 DM. Then I can go even further. You can see post coordination also you can do. STEMI, I will go into STEMI. In STEMI, I will go into further deep down. I will go into what do you say? Acute ST elevation myocardial infarction. Wall also I can take, anterior wall. I can say like that. I can go on. And in fact, functional classification also I can make. Heart failure. Heart failure. I can go. NYHF functional classification, I can further go on. This is not limited to the cardiology. You can do it with anything, like all subjects. It is there. See here, I'll show NYHF class 3. This one, that's how the diagnosis can be done. Now, here also there is a speech to text. I can say, I'll go on speech to text, add some title text. See here, I'll start here. This patient presented to us with history of chest pain since last 2 days. At presentation, he was in cardiogenic shock. Blood pressure was 60 systolic and diastolic was not recordable, and pulse was feeble. And patient was drowsy, and he was immediately taken to the ICU. His bilateral basic craps were heard, and so he was put on immediately NIV and NIV. He was immediately put onto NIV. There he was stabilized with the diuretics and morphine. So once the patient was stabilized, we immediately took him to the cath lab, wherein we stabilized him and we did angiogram. The angiogram revealed left anterior descending artery 100% occlusion. So immediately we passed the wire, inflated the balloon and placed Evermax 3x25 stent. Following the stent, patient was having TB3 flow, and however during the procedure patient did develop ventricular fibrillation, but he was given a cardioversion and patient recovered from cardioversion. Now he is being shifted to the ICU. post during the hospital stay, his events were uneventful, patient is fine. He is advised to come for follow-up after 7 days. Okay, this how you can dictate and generate discharge card here. Huh? This is our speech to text you can do. Huh? It will go and hold on, I will just generate it. Now what it will do, it will take this, all this text here, then this also it will take, and further what all is there in this past records, all the past records, what all patient has got, it will take into consideration. I'll show the past records also here. See what are past records patient has got, it will take into consideration. These are the past records. It will take into consideration and generate the discharge card. See, this has generated the discharge card like this. Thus, you can accelerate your discharge card generation and with help of the Scribe speech to text in NICE HMS.